Hospital officials are saying we are in the worst place that we have been since the beginning of the pandemic, and they're very concerned because bed space is running low in hospitals. Q13's Brian Flores joining us now with which areas are affected the most. Brian, good morning.
Yeah, Bill, good morning to you. No doubt it is the rural hospitals and some of the smaller hospitals in the state that are being affected, but really bigger picture, all the hospitals here in Washington are being affected by this Delta variant, also dealing with a lot of the mental health from the patients and even the hospital staff. Talk about the doctors and nurses. First, though, I want to talk about some of the numbers that were broken down by the Washington State Hospital Association recently. There are 1,673 patients hospitalized with COVID this week. Now, that number has plateaued. We will talk about that in a moment, but also 260 COVID patients currently on ventilators. That's up from 241 last week. They also report 95% of COVID patients currently hospitalized here in Washington are unvaccinated. Now, again, many rural hospitals seeing a heavy impact of this. Cascade Medical Center in Leavenworth, for example, has had to transfer patients to larger hospitals. In one case, they had to airlift a patient to a larger hospital, but many times they use ambulance service, but that means an ambulance is not available to the rest of the public because they had to take that patient further away. Hospital officials also with Providence, St. Peter, and southwestern Washington have set up alternative care sites in hallways and conference rooms because simply they're just overwhelmed.
I can only imagine, and I've talked to plenty of our nursing and clinical staff that are in the room multiple hours a day, and you do almost suffer PTSD from seeing this over and over again, especially knowing that, if only they had been vaccinated, perhaps it would have been a different outcome.
Yeah, that being said, many hospitals are dealing with staffing issues. They tell us some have left because of just being overwhelmed, as I mentioned, but many also say they won't get the COVID vaccine. Many of the staff that have resigned, they say that they won't get the COVID vaccine, and hence they have resigned. Now, they also said this week, at least, and as I mentioned at the top of my report, cases have plateaued. And while that sounds like it is definitely good news, hospital officials say they have not taken into account, or they have not seen the impact yet of some of the larger events, talking about some of the state fairs, for example, many of the sporting events and concerts. Also, school has started up as well, so we may see the impact in the next couple of weeks. And oh, by the way, the flu season, that is right around the corner as well. Guys, back over to you.